Bismillah ar-Rahman ar-Rahim. Hello, my colleagues and my students and my fans. Today I will speak about, to continue speaking about shock syndrome and the different types of shock. Today I will talk about an important topic, which is the septic shock. And I will focus on the non-bacterial causes of septic shock. As I mentioned before, we all know that septic shock is the most common type of distributive shock, and this type of shock is characterized by abnormal distribution of blood, especially in the microcirculation, and this is associated with peripheral hypoperfusion and a hypoxia of the different tissues and organs, resulting in improper metabolic processes in the different tissues and organs due to inability of the oxygen supply to cope with the metabolic needs of the different tissues and organs. So there is hypoperfusion and hypoxia of the different tissues and organs as a result of abnormal distribution of blood, especially in the microvasculature, as I mentioned. So this is generally the basic pathobiology of the septic shock as the commonest type of distributive shock. And as I mentioned before, septic shock is most commonly caused by bacterial causes. But there are also what we call non-bacterial septic shock. The classic and the most common and the most important cause of septic shock is bacteria, but it can also be caused by non-bacterial microorganisms, including viruses, including fungi, and also including parasites. So let me talk about the non-bacterial causes and start talking about what are these commonest microorganisms other than bacteria which can cause non-bacterial septic shock. We all know that the sources of most common sources of the sepsis, whether bacterial or non-bacterial, include the respiratory tract, that is most commonly pneumonia. Pneumonia is a potential source of septic shock, septicemia and septic shock. Respiratory tract infections, especially lower respiratory tract infections, that is the pneumonias, whether lobar pneumonia or the bronchopneumonias. Also, another important source is the gastrointestinal tract. It can be due complicating enteric infections. It can be also complicating an abdominal infection, especially peritonitis and retroperitoneal infections. It can also complicate genitourinary infections, especially pyelitis and pyelonephritis. It can complicate even skin infections, especially cellulitis, and the staphylococcal scalded skin syndrome. That's most probably the staphylococcal and less commonly streptococcal skin infections. Also, it can complicate CNS infections, that's infections of the nervous system, including the meningitis and the encephalitis. So all of these are potential sources of septic shock, whether bacterial or non-bacterial. Let me go back to the main issue, which is the non-bacterial, so whether it is pneumonia, gastrointestinal tract, enteric, or genitourinary or skin infections. What are the commonest non-bacterial causes which can also be implicated in directly or indirectly in the pathogenesis of septic shock? Among the important viruses are the influenza virus and the coronaviruses. So influenza pneumonias can be complicated by septic shock if not properly managed. Although the commonest reason and the commonest cause of septic shock in patients even with influenza pneumonia is secondary bacterial infection, that is co-infection with a bacterial agent. So even in viral pneumonia complicated by viral sepsis and septic shock, we should think about secondary bacterial infection, that is co-infection with a bacterial agent like streptococcal or staphylococcal. The streptococcus pneumoniae complicating influenza pneumonia, that is secondary bacterial infection. So, but the virus itself can still cause directly shock syndrome, septic shocks, and sepsis. This is what we call viral sepsis and septic shock. So the virus can cause directly or indirectly through co-infection with bacterial agent, also the secondary bacterial infection. So this applies to the viral sepsis and also applies to the septic shock associated with fungal infections and associated with parasitic infections, as I will mention. So the commonest viruses which can cause viral sepsis and septic shock are the influenza viruses and the coronaviruses, including the COVID-19, which is responsible for the current pandemic, as we all know. So COVID-19 can be complicated by itself directly by septic shock. Other viruses are the respiratory syncytial viruses, the other rhinoviruses, the adenoviruses, which can cause the respiratory also pneumonias, respiratory infections, and be complicated by septic shock. Also other viruses like the dengue fever virus and the yellow fever virus and the hemorrhagic fever viruses, including the Ebola virus and Marburg disease virus. They can all be complicated by viral sepsis and septic shock. So this is as regards the viruses. As regards other non-bacterial causes, we have also the fungal infections and the mycotic infections. The most common fungus which can be complicated by fungal sepsis and septicemia and by septic shock is the candida. So candidal infection, systemic candidiasis, especially in the immunocompromised people, whether by congenital, hereditary, or acquired factors causing immunodeficiency, including patients with chronic renal disease, patients with cancer, patients with chronic liver disease, patients with diabetes, all of those categories of patients who are immunodeficient, they are susceptible to have candida. And the candidal infection can be widespread. That's transforming from local candidal infection to systemic candidiasis, and if the systemic candidiasis is not put under control, it can be a source of septic shock. So candida is the most common fungus causing non-bacterial fungal sepsis, and if we can consider it as sepsis, although sepsis, that's the presence of pus cells, and a septic condition is strictly and narrowly related to bacterial infections, but it can be extrapolated to include also non-bacterial causes, as I mentioned. So fungal infections can be complicated, especially candida can be complicated by septic shock. And then we have also the parasitic infections. We know that parasites include the helminthes, the protozoa, and the ectoparasites. The helminthic infections and the protozoa are the most common parasites which can cause parasitic septic shock. Among those most common parasites is the malaria. So malaria, especially the severe falciparum malaria, can be complicated by shock, and whether directly or indirectly. That is, the falciparum, Plasmodium falciparum malaria, can directly cause shock, and indirectly can cause shock through secondary bacterial infection or through dehydration as a result of severe vomiting and severe diarrhea, especially in algid malignant malaria, and also through gastrointestinal bleeding, which can happen in severe form of gastrointestinal malaria, or through splenic rupture and internal bleeding, which might complicate falciparum